Welcome to today's episode of the Buzby Dog Podcast, where we're going to be talking about infective endocarditis. Wow, what in the world is that? Well, it's kind of an obscure topic, but I love to tell my patients stories with the goal that it can help another dog. And so it's a sad story today. I'm going to tell you about the loss of a patient named Zimmer, who I love very deeply, and of course his family loved him all the more. But his mom and I agreed that by telling Zimmer's story, we hope that other dogs can be helped and potentially even saved. Zimmer was a senior lab and quintessential gentleman, and he became my patient in 2011. He was suffering from chronic neck pain. Unable to control himself, the lab that he was, he had leapt off of a small wall to chase a squirrel, and when he came back, he was limping and painful. Dogs with cervical disc injury, neck injury, will turn their whole bodies or just shift their eyes to look at something, unwilling to move their neck. And that's just a very obvious telltale sign of a neck problem. Favoring a front leg can also be associated with the neck problem because the bulging disc can compress on the nerve roots traveling to the forelimb. This is called a root signature. And Zimmer had all these classic signs. His vet prescribed anti-inflammatories, pain medications, and muscle relaxants, and Zimmer improved quickly. But he never quite returned to 100%, and that's where our relationship began. I became a part of Zimmer's healthcare team when his owner sought out spinal manipulation and acupuncture as an adjunct to his treatment. And thankfully, Zimmer responded very well and soon just transitioned to maintenance appointments every few months. The last time I saw Zimmer was actually in my driveway. Taking advantage of the perfect weather, we had pulled out chairs from the garage and a blanket for Zimmer. He preferred actually just to lay on the cold concrete, and he was panting as his owner and I just chatted. She declared that he was thriving, having rehabbed through 2 cruciate ligament tears and having no current neck pain. And my exam supported her claims. I didn't find anything of concern. 3 weeks from that date, Chris emailed me because Zimmer was having trouble walking up the stairs. She was out of town, but she relayed the report from her pet sitter, and she asked for my blessing to try non-steroidal anti-inflammatory drugs, commonly called NSAIDs, which she kept on hand and used periodically for his knee arthritis, and I approved without hesitation. We agreed to keep in close touch. Zimmer was back to his old self the next day, and like people, senior dogs can have good days and bad days, and it appeared that he had rebounded from a bad day and all was well. But instead, it was actually the calm before the storm. Though Zimmer continued to appear normal, when Chris returned home a couple days later, Zimmer stopped eating anything other than treats. Now, since an upset stomach is one of the most common side effects of NSAIDs, we considered the medication as the possible culprit and discontinued it, but Chris prudently made an appointment with Zimmer's regular veterinarian, who examined him the next morning. Zimmer didn't have a fever, and his exam was unremarkable, except for swelling in his right front leg. He was prescribed more pain medication and an appetite stimulant, but just to be thorough, blood work was sent out to an outside lab. Zimmer's appetite continued to decrease, and it was a huge red flag. It gnawed at me as Chris continued to email me updates throughout the day. Chris agreed with my concern and took Zimmer for a recheck again the next day. Again, no fever and an unremarkable physical exam, but Chris listened to her mother's intuition and drove Zimmer to our nearest veterinary referral center later that day as an emergency patient. It was a Friday afternoon, and she wanted to be proactive in his care, even though everything was checking out fine. In her heart, she knew everything was not fine, and she was proactive about getting to the bottom of it. So surprisingly, in light of his lungs sounding clear on his 3rd exam with the emergency veterinarian, Zimmer was diagnosed with pneumonia based on x-rays of his chest and a really tricky, difficult to diagnose heart murmur on the right side of his chest, which is a strange presentation. Everything about Zimmer's condition was unusual. The emergency veterinarian recorded in his records that this was a complicated and atypical assortment of signs that is not easily explainable and likely will not easily be treatable either. Zimmer was presumptively diagnosed with infective endocarditis, a serious condition which can cause acute heart failure. Infective endocarditis occurs most commonly in large breed dogs. An echocardiogram, which is an ultrasound of the heart, was used to identify a heart valve lesion, and blood cultures are taken, special types of blood tests where they actually grow out the blood to see if there's bacteria in it, and this confirmed the diagnosis. His lame leg, that lame front right leg, had been the clue. These dogs can have a thromboembolus, which is a fancy name for a blood clot that forms in the heart, breaks off, and travels down to an artery in the leg, in this case the right subclavian artery of that front leg, and it can lodge there and cause swelling, pain and lameness, similar to a person who has a blood clot in a leg which causes swelling and severe pain. Poor Zimmer. Multiple medications were pumped into his body through IVs, and Chris knew he was so sick her only option was to leave him at the hospital for treatment. Always the stoic patient, he was much sicker than he appeared. At 3 a.m., Chris was awakened by a phone call with chilling news. Zimmer was in respiratory distress, and humane euthanasia was the only realistic option. It was the gift that he needed most. Zimmer had waited for her to come home from vacation, and now he waited for her to drive back to the referral center. Even though he was struggling even to breathe, his eyes brightened when he saw his family walk into the ICU. Chris later wrote to me and said, "I'm so glad I saw that. He knew we'd come back to be with him. I even imagine as the medicine helped him leave us, that he could hear us tell him how much we loved him and what a good boy he was. He had a wonderful life. I just wanted to be selfish and have it continue a while longer." Can't we all relate to that? Zimmer's story, as I said at the beginning, is told here so that, in a sense, his life may continue on and hopefully help another dog. I want to summarize with 5 lessons we can learn from Zimmer. Number 1, loss of appetite is a significant clinical sign in dogs and needs to be followed up on. In other words, call your vet and discuss getting an appointment. Number 2, if your dog is ill, having access to blood work results immediately may be life-saving. Most practices can run in-house blood work and you can have the results right away. Number 3, don't be afraid to ask about referral to a specialty hospital where your dog will have access to multiple specialists, advanced diagnostic testing, and round-the-clock care. Generally, these facilities offer emergency services and accept walk-in patients. So certainly, Zimmer's primary veterinarian did nothing wrong here at all, but the advantage of the specialty facility, in addition to the round-the-clock care, was that they had advanced diagnostics and were ultimately able to find the diagnosis. Number 4, pet owners should trust their instincts. You know your dog better than anyone. And number 5, a dog can be very sick and still have a normal temperature. In this case, it was shocking that Zimmer wasn't running a fever. Also, keep in mind that certain drugs, such as non-steroidal anti-inflammatory drugs that we use for pain, can mask a fever. This podcast was recorded in honor of Zimmer. I'm so thankful for my patients and all that they've taught me over the years in their lives and even in their passing.